Hello friends, we have studied the part 1 of the unit 2 pharmacology of drug acting on cardiovascular system. We have studied the chapter of this unit, that is drugs used in the therapy of shock. So today we will study the part 2 of the same chapter. So today we will study about the different stages of shock. Mainly it is considered of three stages. The first stage is compensated shock, or we can say stage of compensated shock. In this stage of shock, the body restores the physiology by means of multiple physiological mechanisms and also through the release of required compensatory mediators. But in case body's compensatory mechanism fails to restore normal physiology, then next stage is considered as decompensated shock stage, which is mainly manifested by poor peripheral pulse. And further and finally we can say chronic decompensated shock stage, if not managed properly at right time, it becomes the stage of irreversible shock. Now, let us discuss in detail about the compensated shock stage. In compensated shock stage, the compensatory mechanism of the body restores or maintains the normal blood pressure through multiple physiological mechanisms with the help of released mediators. Later we will discuss about these mediators who helps to restore this normal blood pressure. It seems that through few of the researches, experiences and by some medical case proves that shock conditions due to unexplained tachycardia, mild tachypnea, delayed capillary refill, orthostatic changes in pressure or pulse, irritability. So due to all these reasons, if shock is there, is made compensated by the body. Now have a look through what kind of compensatory mechanisms body restores the altered physiology in case of compensatory shock stage. Here one by one I am discussing in short. Firstly, baroreceptors and chemoreceptors disinhibits vasomotor centers, which increases adrenergic output, which helps to restore the altered physiology. Secondly, through the renin-angiotensin system with the help of angiotensin 1 and angiotensin 2. Third, through the antidiuretic hormone. Fourth, by the aldosterone from the adrenal cortex. And fifth is the vasopressin from the posterior pituitary. And sixth, through the ACTH from the pituitary, that is cortisol. Now let us discuss about the stage of decompensated shock. As earlier we made the discussion if or in case body's compensatory mechanism fails to restore the normal physiology, the next stage of shock is considered as a decompensated shock. And in this stage, there is an inadequate end organ perfusion, and this stage is manifested by several symptoms or the sign. In this stage, mainly the compensatory mechanism fails and hypotension occurs. It is the first sign and the symptom. Secondly, increased tachycardia is there, increased tachypnea is there, altered mental state, low urine output, poor peripheral pulses, capillary refill markedly delayed, and cool extremities are there in this stage. These are the normal signs and symptoms which we can monitor in this decompensated shock stage. Now, let us discuss about the third stage of shock, that is stage of irreversible shock. This stage of shock occurs as a consequence of decompensated shock, which is not managed properly at the right time. Or we can say, if decompensated shock stage is chronic and not maintained, managed properly at the right time, so that stage will responsible for the stage of irreversible shock. In this stage of shock, there is a permanent cellular damage and multiple organ dysfunction syndrome. So this stage is mainly marked by the multiple organ dysfunction syndrome, which is due to the permanent cellular damage. And in earlier part 1 we have already discussed about the reason behind the permanent cellular damage. Next, once cellular permanent damage is there and multiple organ dysfunction is there, the recovery does not occur even after the adequate restoration of circulatory volume. So finally death occur due to refractory acidosis, myocardial and brain ischemia. Now, after the successful discussion about the stages of shock, let us discuss about the different types of the shock. The first type of the shock is hypovolemic shock. The second type of the shock is cardiogenic shock. Third type of the shock is distributive shock. The fourth type of the shock is obstructive shock. Fifth type of the shock is hypoadrenal shock. The sixth type of the shock is septic shock. The seventh type of the shock is neurogenic shock, and the eighth type of the shock is the anaphylactic shock. So we will discuss in detail about these different type of the shock reasons of the shock, treatment of the shock, and the monitoring of the patient during the treatment of these type of the shock we will discuss in our next class. So we will continue the third part of same topic. Till that, have a nice day and thank you.